Hello, and welcome to my presentation on working with students affected by fetal alcohol spectrum disorder. This presentation is intended to provide viewers with some basic information about fetal alcohol spectrum disorder, also known as FASD, and some tips to keep in mind when working with students affected by FASD. To go along with this presentation, there is a handout which covers some basic strategies to use when working with students affected by FASD in the classroom, as well as a list of recommended resources to check out for further information. Before we begin, I have two disclaimers. The first one is that there are no pictures in this Prezi. I know it is a bit misleading with the picture frame background. However, I do have a reason for this choice, and that is that historically pictures have been used in literature and media to indicate that there are higher rates of fetal alcohol spectrum disorder within certain cultures, ethnicities, and socio-demographic groups. I wanted to avoid perpetuating these stereotypes, so I have chosen not to use pictures, as well as I really wanted to emphasize that FASD is an invisible disability and that you cannot look at somebody and immediately identify them as having or being affected by FASD. My second disclaimer is something that you might have already picked up on, and that is that I will use the phrase affected by FASD quite a bit throughout this presentation. The reason for that is that I want to make a distinction between the student and the disability. So I'll be using phrases like affected by FASD, impacted by FASD, or living with FASD, and I'll try to avoid using the phrase student with FASD because it puts the disability at the forefront. So let's begin. The first questions that we're going to ask ourselves is, what is FASD, and why is it important for teachers to have a working knowledge of FASD? Fetal alcohol spectrum disorder is an umbrella term referring to a range of possible effects caused by prenatal exposure to alcohol. FASD itself is not a diagnostic term, but an educational term. We will go over the different diagnoses in the acronym section. It is important to know what FASD is and how to work with students affected by FASD because it is an incredibly common disability and one that you will encounter throughout your career, if not in your practicum. According to Health Canada, FASD affects 1 in every 100 births and is the leading cause of developmental delay in North America. This statistic is actually quite conservative if you consider that FASD is underdiagnosed in the population. There are higher rates of FASD in communities with higher alcohol consumption, so depending on where your practicum placement is, an understanding of FASD is going to be incredibly helpful, and it's also going to increase your hireability if you go to apply in that area later. Something to be cognizant of when working with students affected by FASD is that there are lots of moral judgments that are made that get in the way of service provision. To avoid making judgments about alcohol consumption during pregnancy, try to keep in mind that alcohol is a legally and socially acceptable drug in our society. Another thing to keep in mind is that women rarely drink alone. Men are usually there when women are drinking, and they can even be pressuring their partners to drink. So it is an issue that involves both men and women. Another thing to keep in mind is that there's often 3 or 4 weeks before a woman even knows she's pregnant. She could have, unknowingly damaged her fetus before she even realized she was pregnant. So you do not have to be an alcoholic to have a child affected by FASD. Another thing to remember is that FASD has only been recognized since 1973, and there are still lots of conflicting messages about whether or not it's safe to drink during pregnancy and how much it is safe to drink. So the best thing to keep in mind is that there is no safe time or safe amount to drink during pregnancy. Alcohol and the developing fetus. Alcohol is a teratogen, and a teratogen is a substance or condition that disrupts typical fetal development in the offspring as a result of gestational exposure and causes birth defects. So what that means is that alcohol can cross the placenta and interfere with the developing cells in the fetus. There are 2 rules governing teratogens, and that is the greater the dose, the larger the anticipated response. And the pattern and timing of the dose affect the type and severity of the response. So what this means is that depending on how much alcohol was consumed and when the alcohol was consumed means that you'll have different effects within the fetus. This is why fetal alcohol spectrum disorder is a spectrum disorder, and it is also why they say that no child affected by FASD is the same. Prenatal exposure to alcohol can cause 4 distinct outcomes, and those are death, malformation, growth deficiency, and functional deficits. There are other factors that influence whether or not a child will be born with FASD. Exposure to alcohol is, of course, the main factor. However, you have to also factor in maternal age and health, prenatal care, the condition of the mother's liver, and the baby's ability to metabolize alcohol. Just because a woman drinks during pregnancy does not necessarily mean that her child will be affected by fetal alcohol spectrum disorder. So alcohol affects whatever is developing in the fetus at the time, keeping in mind that the brain and central nervous system are developing in the fetus throughout pregnancy, so they are always at risk of being affected. And most importantly, FASD does not discriminate. It can be found in any socioeconomic or cultural group. Wherever alcohol is being consumed, there is a risk of FASD. The world of FASD is a world full of acronyms. What you need to know is FAS, PFAS, ARND, ARBD are diagnostic terms. FAS is fetal alcohol syndrome, and that was what was discovered in 1973. Later came the diagnoses of partial fetal alcohol syndrome, alcohol-related neurodevelopmental disorder, and alcohol-related birth defects. These diagnoses are based on how an individual ranks in 4 categories, including confirmed prenatal exposure to alcohol, facial features, growth, and brain functioning. So people often assume that individuals with partial FAS as their diagnosis thought to be higher functioning than an individual with full FAS. And this is a bit of a myth. So the only difference between an individual partial FAS and an individual diagnosed with full FAS is that individuals with partial FAS do not have the facial features of FASD. However, an individual will only present with the full facial features if alcohol is consumed during 3 specific days in early pregnancy. Also, individuals grow out of facial features. So this is why facial features are not a good indicator of whether or not an individual has FASD. The term FAE, so fetal alcohol effects, you may also hear, and this is an outdated term but is still used in the US. It is not a diagnostic term. It is extremely hard to get a diagnosis of fetal alcohol spectrum disorder. There is no simple test that can be done, so a child has to visit a multidisciplinary team. These teams are very expensive, and there is a long wait list. So the multidisciplinary team in Victoria has a current wait list of 1 year. Members of this multidisciplinary team are a pediatrician, a psychologist, an occupational therapist, a speech and language pathologist, and a social worker. If a child does not get a diagnosis before they turn 18, then they have to pay for a diagnosis. So if the individual lived on Vancouver Island, they would have to pay around $5,000 to be assessed at the Asante Centre. That's why there is a large push to have individuals diagnosed when they are children, is because that it is free. It is extremely hard for a child to get a diagnosis if there is not confirmed exposure to alcohol. This has ramifications for children involved in the foster system or children who have been adopted and do not have that information readily accessible. There is a disproportionate number of children affected by fetal alcohol spectrum disorder within the foster system and who live with adopted families. For children who are still with their birth families, this means that somebody within the family has to be able to admit that drinking occurred during pregnancy. And this is often a very hard and traumatizing thing to do, especially for birth mothers. Finally, if a child is functioning well on the day that they get assessed, they may not get a diagnosis. And different diagnostic clinics are more conservative than others. So one clinic may not give a child a diagnosis, whereas another would. So 2 important things to keep in mind as a teacher. One is you will have children in your class who do not have a diagnosis or any support and will not be able to get a diagnosis. The second is the diagnostic process can be extremely stressful to families and is often frustrating because it does not immediately qualify the student for any resources or support. Most services, including funding and respite services, are based on an IQ rating, which is extremely frustrating for families because many individuals affected by FASD have a low average or high average IQ and therefore do not qualify for those services.